Hello, and welcome to the Summit Ascent series hosted by the Sorenson Impact Institute. We're excited to have you all here with us to learn more about accelerating social change with Pay for Success financing. I'm Nzinga Broussard, Senior Director of Impact Measurement at the Sorenson Impact Institute. The Institute connects capital to impact through innovative finance structuring, impact measurement and management, impact strategy, and human-centered storytelling. We are proudly housed at the University of Utah's David Eccles School of Business, where we also help to train future leaders in impact. Today, I am joined by my colleague and Managing Director of Impact Finance and pioneer in Pay for Success, Janis Dubno. We are also thrilled to have Brian Burrows, Chief Operating Officer and General Counsel at the Institute for Child Success, and Simone Gross, Director of Investments at Maycomb Capital, both leaders in the Pay for Success field. Janis, Brian, and Simone worked together to develop a Pay for Success model in Spartanburg, South Carolina, to improve outcomes for young children and their families. Our goal today is for all of us to walk away with three important takeaways: gain valuable insights into the strategy of organizing, modeling, and implementing a large evidence-based multi-partner PFS project, learn about the challenges this team experienced and the solutions they developed, and discover the impact that this project is making in its South Carolina community, as well as the overall benefits of improving early childhood health and education outcomes in underserved communities. I will now ask for the panelists to introduce themselves and the role their institution played in this project.
Hi there, I'm Brian Burrows with the Institute for Child Success.
I'm Janis Dubno with the Sorenson Impact Institute, and I lead our impact finance team. We collaborated with the Institute for Child Success and Maycomb Capital to develop the project and the financial structure.
Hi, I'm Simone Gross, Director of Investments at Maycomb Capital. We were the investor in the project and through our flagship fund, the Community Outcomes Fund, which is a provider of outcomes financing for social services.
Thank you and welcome. Brian, I would like to start with you. Can you tell us about the Hello Family PFS project? And for those of us less familiar with Pay for Success models, can you give us an overview of PFS?
Yeah, let's start there. So, Pay for Success is a way that government can finance outcomes rather than financing or instead of financing services that produce those outcomes. So, for instance, you might want, as a small municipality like Spartanburg, you might want to make headway on kindergarten readiness, but not want to necessarily fund directly preschool or other wraparound services or the like. You might just want to finance that improvement in kindergarten readiness. And so, through Pay for Success, the government contracts for those outcomes, and because service providers can't wait for that financing to come in later, an impact investor provides the upfront capital to deliver the services such as preschool or nurse home visiting. And then as those outcomes are achieved over time, the government pays back that loan. And so the lender is taking on the risk if the outcomes aren't achieved. They may not receive all of their principal and interest back, but if they are, then they would receive their principal plus a modest return. So translating that into the Hello Family project specifically, Hello Family is a suite of services that are all aimed at this flag on the hill that the city of Spartanburg and its community stakeholders were aiming at, making sure that every kid who's born in Spartanburg can reach the schoolhouse door healthy, thriving, and ready to learn. And they were motivated to do that really due to an aim at health equity improvements and at cracking problems around intergenerational poverty. And just speaking really briefly to the health equity, Spartanburg is a city in the South that has about half of the population is Black, and a white child born in Spartanburg can expect to live about 17 years longer than a Black child born in Spartanburg. And this was obviously unacceptable to the community. And so this was one of the reasons why they were trying to tackle early childhood, because it's such a strong lever for long-term health and long-term economic impacts. So looking at what outcomes the government was trying to achieve, First and foremost was that schoolhouse door, reaching it healthy, thriving, and ready to learn. And then as part of that, we looked at what the research showed moved the needle on that. And the broad buckets included improving metrics around child maltreatment, so reducing child abuse and neglect, reducing avoidable ER visits, which is both a child maltreatment metric, but also an early health metric. And then going even earlier, improving birth outcomes and early childhood health and development through things like nurse home visiting and community doula services. So looking real quickly at the suite of services that this transaction provides. This chart shows sort of the continuum over time. So Birth Matters is a community doula model where members of a particular neighborhood are recruited to train up as doulas, and then they provide services to families in their community. And that has really significant impacts on birth outcomes such as improved birth weight, reduced stays in NICU, and the like. Then after birth, Family Connects is offered to, it is a low dose, universal home visiting model where every family who gives birth in Spartanburg is offered a home visit by a nurse and sometimes two, depending on what's needed. And that clinical visit provides wraparound supports and the like through referrals. Then the next one is parenting and family supports called Triple P. It used to be called Positive Parenting Program, and I guess there was, for whatever reason, they renamed themselves into the word triple and then the initial P. And then Quality Counts, which provides continuous quality improvement for early care and education centers, tackling that early learning directly. And this is just this is not meant for you all to read and commit all of this to memory. This is just a list of all of the partners who were critical to making this go forward. So I wanted to take a moment and thank it, especially the people on this call. But there were, I think, about 30 contractual partners, and then a number of contractual partners who helped tee up the project and get it launched. Sorenson and Maycomb were huge partners in that effort. But it was truly a community-wide systems change approach. So I think that's the 30,000-foot view of Hello Family, Dr. Broussard. And so gonna pass it back to you.
Great. Thank you for setting the stage for this discussion. And I really like that last slide that really showed all of the different players or partners involved in this. And as I understand it, we can kind of group it into maybe 3 or 4 key players. We have the government, but we also have the service providers, an impact investor, and a financial structuring partner. And so, Brian, why did ICS engage the Sorenson Impact Institute for this project?
Because they're great at what they do. So we had done a lot of work in Pay for Success, or especially around the feasibility analyses in the early childhood space. But this was one that it was pretty clear it was going to be complex. We wanted it to be resilient and not encumbered by that complexity. And so we really wanted the top minds looking at that financial model, making sure we'd looked at it from every angle, making sure we were looking at it for resilience, and so that we could ensure that these outcomes were achieved for the community.
And Janis, do you want to add anything to that in terms of that, our engagement and your engagement with ICS?
Yeah, we've been collaborating with Brian and ICS in the early childhood policy world, and also in the early days of outcomes-based financing and getting legislation. So we were thrilled when Brian reached out to us to see if we'd be able to partner with him in developing and structuring the project. And it's been actually include Maycomb in this as well, has been a really fantastic and productive partnership.
Right. Simone, from Maycomb, why was this investment appealing from an investment standpoint?
Thanks, and I'll get there in a second. I just want to echo a little bit about what Brian was saying about Sorenson, because yes, there's a lot of complexity in this structure, but actually, for it to work, is to boil that down into a simplified structure where you can assign roles and motives to everyone and align those motives and align those incentives. incentives. And so that's why actually someone like Janis is really key to making sure everybody knows what role they want to play and correctly assigns value to it. So we are definitely here because of turning that early complicated mud pie of all the problems and issues that we were trying to respond to into 4 interventions with a number of corresponding outcomes. So I guess that takes me to my answer about why we were excited to do this and why the investment was appealing. And I would say that's because when we provide outcomes financing, what we're looking to do is to provide capital that can expand or scale upon, social programs that deliver real, measurable outcomes to communities. And by aligning our financing with spending that is geared towards results, we are able to allow for that scale without compromising any of the impact or accountability or transparency and collaboration that came in through with that, project development that Brian and Janis were talking about. And so, like, specifically here in Spartanburg, what we're really lucky to be able to fund and privileged to fund is that the programs we're expanding get to focus on those outcomes that Brian mentioned, less NICU utilization, less child maltreatment, and then more children that are ready. I can never get Brian's line right about getting to the schoolhouse, ready to thrive and learn. But that's what
Healthy,
we're
thriving,
doing.
and ready to learn.
Thank you. I had the luxury and joy of learning a lot of that from Brian as we were working on the project.
Nice. Janis, I want to come back to you. Can you tell us how this project is innovative?
So the project itself is innovative, and in PFS, this is the first community level birth to 8 continuum of services project in existence. I don't think there's actually been one since either. And I think, as both Brian and Simone mentioned, and that's quite complex. There are 12 outcome metrics. So it was very important to be thoughtful about what those metrics are. And one of the things we really wanted to be intentional about doing is fully capturing the impact that this continuum of services population-based project would have. And that is, I think, very, very important. The other part is that it's very innovative in terms of the payment amounts. PFS projects prior had mostly been, the payment amounts are mostly based on fiscal savings. Well, I'm very happy to report that Brian was very successful in convincing the outcome payers that they should also pay for a portion of social value for some of the outcome metrics. And that's super important, particularly in early childhood, because while there are fiscal savings, there's also incredible and downstream impacts in societal value that downstream do turn into monetary savings, but very hard typically to capture in a PFS project that's maybe 5 to 7 years. And so it was very innovative that way. And I think at least from someone in the finance world, one of the most gratifying pieces of the financial structure is that it does include and capture some of the social value.
I'd also like to add I think it's the first and you alluded to this, Janis, when you talked about it being community-based. It reaches every family. Every person who gives birth in Spartanburg, South Carolina, has at least one meaningful contact from a nurse about what's going on and providing the supports that they might need. So we meet every family, and we meet them where they are. And that has, I don't know that that's been done, and I don't think it's been done in Pay for Success. It's also just rare, generally speaking, where you're actually reaching everyone in a community from any social service perspective. And Pay for Success really makes that possible because it allowed us to get the capital necessary to launch at that scale.
Simone, is there anything you want to add to that, or have they done a great job of answering why this project was so innovative?
As usual, they've done a great job. I would maybe expand upon some of what Brian was saying about why it's innovative from a financial perspective, in that, and to Janis's point point about this being one of the first that looked at social value in addition to or instead of savings, is really then saying, well, looking at the individual who's going through each of these services and saying, what do we hope for them to achieve? What outcomes are we looking for person that is participating? And that, I think, is really flipping the script on how it had been done in the past, because it used to be, or programs in general are focused on sort of the cost savings at the payer perspective. And so because of that, we're centering our participants and the community. And so that helps to rectify something that's like somewhat broken in how social services are procured in this country, in that the payers are setting the terms of what success looks like. Pay for success. Success is the key term there, not pay part. It's a success generated for families. And so this really makes sure that we're shrinking that gap. We're still not fully getting rid of that gap because, community members aren't driving the project entirely, but we are really developing a proxy to minimize that gap in sort of empowering the voice of community to identify the outcomes that we want to achieve, and then aligning all incentives to achieve those outcomes. So each of our service providers know exactly what they're driving towards. They're not spending down a grant or just going after cost reimbursement. They are hyper fixated on achieving the outcomes that our families want to see. And we're very lucky to have government payer and Chris Story, who fully believes in this approach. So that's also very innovative, which is really great.
Yeah, I felt a little guilty when Janis was saying that I did a good job convincing them. They were easy to convince. This was something where they were not going after cashable savings. They were going after community benefit.
Yeah. And that made it really appealing to us as an investment.
So Simone and Janis, I heard you both mention resilience, scalable. Can you talk a little bit more about what components of the project gave it structure to make it resilient and scalable?
Sure. Simone, I'm happy to start off and then hand it over. So, as we've mentioned, there were 4 interventions, 12 outcome metrics. So we had to be really intentional about the financial structure and the model. And this was extremely important, particularly as we were thinking about the timing of the outcome payments for each of the metric and the combination, because we wanted to build a financial structure that could handle disruptions or changes and not negatively impact the financial returns or the outcomes for the community. So we were quite intentional and thoughtful about that. And I think from what I see in the implementation of the project, that this has really allowed for some adjustments to be made in real time that benefit the community, but not necessarily a payment metric. But these adjustments are able to be made, and it does not negatively impact the financial structure or the returns. And so, would love to hand it over to Brian and Simone to add to that and to talk about some of those adjustments, because this is continuous improvement in real life and how the financing model and the structure that we developed is allowing this to happen and aligning incentives among the community and all the stakeholders.
Thanks, Janis. Yeah, that is definitely at the crux of what's so innovative about the project, is its ability to continue to evolve with real conditions on the ground. And so as our providers learn more about the community they're serving and how their intervention plays out, they are able to make the adjustments that are needed. I think Brian and I are both really proud of one of the learnings that has come out. I'm going to hand it over to Brian to do it its justice and explain it correctly. But, the interventions are a continuum of services. And so there are doulas and there are home visitors, and both of them are focusing on that really early stage of prenatal and postpartum, early motherhood. And one of the outcomes we're looking at there is breastfeeding. But that's just does the mom engage in that? It doesn't ask the whole question of, does the mom have all the resources she needs to provide nutrition to her baby? And so we realized that that's a bigger question that we needed to focus on. So I'll let Brian share what we did with that information.
Well, and it brings me right back to the meeting every family and meeting them where they are. What we were hearing from the doulas and the nurses and those early interventions was something that never showed up in the data, which, to get pretty technical here real quickly, Women, Infants, and Children is a program that provides nutritional supports to pregnant moms, but also to newborns and to postpartum moms. There's a sort of a technical issue with that where in order to get nutrition supports for baby, you have to, after birth, meet with a nutritionist who's part of the WIC program, which by and large in Spartanburg and everywhere across the country takes several weeks. And so if you're coming home from the hospital with a 4-pound baby who just came out of NICU and you're nutrition insecure, that's just hell. That's awful. And what we were able to do is see that playing out in real time because we were talking to all of those families. It wasn't being tracked at an administrative level. We never saw it in the data when we were planning this, but we were hearing from the families that this was going on. And so there were one really quick thing that we were able to do, which is set up basically a formula bank for that gap. It was super cheap, super responsive. But then the more exciting one is that the service provider, the health system, I'm sorry, is partnering with the state's Office for Women, Infants, and Children and creating a partnership where they're actually going to be able to enroll moms and have that nutrition visit on the maternity floor right after giving birth. So before they're even discharged, they're going to have access to those nutrition supports, which provides a whole other level of benefit for the families in Spartanburg, but also a model that can be used elsewhere. And so we believe it's the first in the country like this. And we're excited that this type of project is bringing systems change tools to everyone, not just those in the community. But hats off to Maycomb, because as the lender, breastfeeding is a metric that you could look at this from a purely transactional perspective and say, oh man, giving earlier formula access is going to hurt that payment metric. But both because Maycomb is an awesome partner and also because of the resilience of the project, that never even came up. In fact, I didn't even think about that dynamic until we were preparing for this conversation. It just never came up in conversation that, oh, wait a sec, what's that going to do to this one payment metric? It was always about what's best for the kid.
Thank you.
Thanks for that shout out, but I have to, pay it forward and pay it back and say that part of the reason it was so easy for us to hold our values and our principles about how to be in this project is that you all had built, particularly Janis, built this very resilient model that allowed us to say breastfeeding is a small component of the overall outcomes that we are trying to achieve in lifting up, half a generation of kids in Spartanburg to get to the schoolhouse ready, thriving, and the rest
Ready
of
to
Brian's
learn.
group. Thank you. But it's not the be all and end all. And in this case, for those certain families, the formula bank was more important. And so the program allows everybody to make the best decisions, meeting families where they're at in real time. And without that resiliency, I would have, who knows? I would love to believe that we would have always, of course, made the right decision. But to Brian's point, I never even had to think about it. I didn't even have to say, can I stick to my values? They weren't even in conflict, which is that much better.
And just to follow up on what Simone was saying is that when we built the financial model, we made sure that we didn't over-rely on any one particular metric. And that was very important in terms of the payment amounts and the timing. And so that it did create the conditions for flexibility within the community and for the partners to meet the needs of the community. But certainly don't want to underplay Maycomb's orientation to community benefit. I've worked with them on a few projects, and I just have to say they are They are some of the best community partners a community can have.
Agreed.
Thank you.
Brian, why had this not been done previously?
So this is an interesting one because there's no new idea under the sun, I think is the line. Every one of these services had been done elsewhere. These are by the nature of pay for success, we have to be deploying evidence-based initiatives. And there have even been some communities that have aimed at this continuum of services. So for instance, the baby bundle in I think it's Bridgeport, Connecticut. There are other examples where folks are trying to do wraparound work. One of the real challenges with doing that kind of work, though, is how do you finance it in a sustainable fashion that lines up everything in a reinforcing fashion? And that's incredibly hard work. And I think would have been impossible in this context without something like Pay for Success that could bring enough capital to bear so that all of these things could go at the same time. And so I don't think it's a lack of interest or a lack of understanding that these are the services that families need. It's just that now we have the tools in innovative finance and we have the partnerships and the relationships to pull something like this off.
Cool.
Mhm.
Simone, go ahead.
Thank you. I would just add, it's also, I think, I agree with everything Brian's saying, sort of that each of these interventions existed.
Mhm.
Layering them is really great, but we also do owe kudos to the partners on the ground in Spartanburg, particularly the city of Spartanburg, for
Yes.
saying, let's layer on that sustainable financing perspective and think about how to do this so that we're building the infrastructure for continuing this so that it goes on once we determine that these interventions are the right suite of interventions, and then adding on services that are complementary and reach other outcomes that we're trying to go for.
Mhm.
So I think all of us played a big role, but really the city of Spartanburg made it happen.
Absolutely.
So you all have helped us understand the structure, how this project is innovative. But I think for many of us, we're really interested in the outcomes. So
Yeah.
I don't know who can take this. Brian, Simone, what has been the impact to date in Spartanburg?
You want me to start, Simone? So when you look at the 12 metrics, a lot of them are sort of the ones that you can watch happen in real time, and those have been going great. I think we're ahead of schedule on our outcomes on the overall outcomes metrics. The one that was most recent and most exciting was now that I think in a few days we're going to be 24 months into the financing. Now that we've reached that point, we're able to look back and see things like how many kids had a reduced ER visits in the first 6 months of life. So we just got our preliminary data on that, and we're right at what we were expecting from that reduction based on the research, which is very exciting. Anybody who's a data geek in the health space knows that hitting what the research says is not a guaranteed thing. And so we were very excited to see that. I'll also say that there have been a lot of fun outcomes that weren't baked into the project. The WIC example is a great one. There have been similar stories around blood pressure cuffs, around breastfeeding supports that are more culturally sensitive, and in fact, we had one, and I think the first month maybe of the initiative bringing on its services. We had a mom who came home and a couple of weeks in was feeling tired, and she kind of thought to herself, well, I just grew life, delivered life, brought life home, have not gotten any sleep. So of course I'm tired. And so she kind of wrote it off as just this is a exhausting phase of life. But then when the nurse came to visit, she discovered that mom was about to enter an acute medical event. And they rushed her to the ER. They rushed her from there into the ICU, and she spent 24 hours in the ICU, but made a full recovery. And so, baby gets to keep mom is not a metric that we built a payment around, but it's really rewarding to be able to be part of that. Simone, what did I leave out?
I think our NICU admissions have
Yeah,
been very
go ahead.
impressive
Keep going. Yep.
in that there is no utilization of the NICU.
Hmm.
So that's, fantastic also, and really testament to the fantastic community doulas that are in Spartanburg and working so closely with those moms.
And if I could just say for the audience why I'm clapping is that if you look at the research around prematurity and the adverse impact of that lifelong for a child and individual, it is really significant. So reducing prematurity is a huge metric to improve for community health and individual health. And so that's way ahead of schedule because
Yeah.
we certainly didn't predict zero. So that's fabulous.
And I'll add from a more mercenary perspective, it's also really expensive to the insurers, including the state, to provide those NICU days. And so reducing that demand has a really significant impact on the sustainability of these services after the Pay for Success project, after the initial project concludes. It's a much easier political lens to come at the sustainability question from.
Yes, and it also has the knock-on effects of relieving pressure at the NICU for the other families that are in it. And so even for the families that
Yes.
are not part of Hello Family, they also get to benefit at a community-wide level.
Yeah.
And having had the privilege of touring that NICU, it is incredibly impressive. And so it's great
They do
that
great
those
work.
features are still there. I think also that's another one of those, actually, that flagged me, another one of those that none of us, three of us, didn't predict, but the realignment, reassignment of really fantastic healthcare workers within the community through these interventions and creating sustainable pathways for that talent pipeline to stay
Mhm.
in maternal health, when that's not always sustainable, and coming in and out of like roller coaster of funding through the pandemic. There were, that's a talent workforce we have to fiercely protect and make sure they stay engaged and have interventions that are impactful to them and meaningful to them and that they don't burn out. And I think the
Yes.
model helps with all of that, but also helps shore up a community when they're facing other interventions that are not as sustainable.
Mhm.
Great. So I have one more question before we open it up to the audience. Are there plans for this model to be replicated? And if so, under what conditions will a similar model work?
Simone, do you want to start, or do you want me to?
Go ahead.
So we're really excited about the possibilities for this and other communities. I think in the last 3 days we've spoken with 3 different communities that are interested in this, and that interest is growing as the outcomes are sort of providing proof points that this type of model can provide that self-reinforcing support to the entire community and really provide the outcomes that the community needs and the supports that the families need. So yes, there are absolutely plans in the works. We love this team and we want to keep the band together and go on tour.
Yeah, I would also add that I had been working in the social impact bond pay for success space for a number of years before this launch, but this was my first maternal health project, and is no longer our only maternal health project because there were a lot of learnings that enabled us to build others that are different, but each have their own structures that are culturally responsive and responsive to the community needs. So we have another project that's around home visiting. It's not community doulas because that's not the approach in that community, but it is still about improving health outcomes for moms and babies.
Yeah. And piggybacking on that real briefly, we don't expect that any replication of this is going to look exactly like this.
Right.
Hello Family was built to line up the research of what we know works with what the outcomes the community was aiming at, and in that early childhood space, and again with a continuum self-reinforcing supports, but it's not going to be cookie cutter. We're going to all of these are going to work best when they're very responsive to the community.
Definitely makes sense. So I want to say thank you for the interesting discussion, and I'm sure our audience members have questions of their own. Just so everyone knows, please, if you have questions, dump them in the comments box, and we will definitely go through them and get them. I think we have our first question. Did you do any economic projections before starting the project? If so, what were the results of the projections?
So yes, we definitely did, and this was Janice. I feel like this was really your core work with the valuation questions. Do you want to dig into that, or do you want me to?
Yeah, I think it depends upon what you mean by economic projections also. Um, so we so what we did, so they're not it so what we did is we looked at projections of what the value of the outcomes were worth, and we built some modeling around that. But we used those in the financial model as a starting point. Um, but so and we based that off the literature primarily, and then we went through a number of data requests from the agencies in South Carolina to get actual numbers that were specific to South Carolina, so that we could refine those projections to be specific to the local area. So so I guess you could say that we used the literature that looked at the projections of what these outcomes. One, we looked at the literature behind the interventions to see what their outcomes were and the impact rates. And then we looked to the literature to find out what those outcomes were worth. And then from there we refined it with actual data. And then ultimately it's a negotiation between the payers and the investors and the intermediary as to what the final payment amounts will be.
Yeah. If I can add, when Janice says there were some refinements, she's underselling the point. One of my favorite data requests was, "Hey, we would really like to know, based on this shape file of the really weird lines of Spartanburg's borders, moms who live within that shape file, who are under 24 years old, who give birth, where that birth is funded by Medicaid, and then they come back within the first 6 months and either spend the night in the hospital or go to the ER. How much did we bill the insurers for those visits, and then how much was reimbursed?" And like, this was not subtle questions. This was not just relying on a research meta-analysis that says ER visits cost $5,000 pop. It was really very specific and very detailed and a lot of fun.
Our second question from the audience: how did you set the pay rate?
Ma- And so just to follow up on that, what the fiscal value is worth, looking at what the literature says is the long-term social value, that's the starting point. And certainly in terms of the fiscal value and the savings, we looked at those values for the pay rates to the agencies that would accrue those savings. I'm sorry to say we didn't get full social value, but we did get some of it, and that's very important. And then ultimately, it is a negotiation between the payers and the investor and the intermediary, because the financial model, you have to bring together what pencils for the investors and the investment and what fits the budget of the payers. And so that's where the negotiation is. And I think what's really was really remarkable about this community, and again we'll defer to Brian and Simone to expand upon this, is that this was not a contentious conversation and negotiation. These were, a community that understood what the value was and came to the table in good faith, and really collaborated to come up with the pay rates that made sense for each of the metrics, but ones that were, reasonable to get the project done. But I'd love to hand it over to Simone and Brian to expand on the question.
Thanks, Janice. Yeah, I think to that point about how this is an ongoing conversation between the investors, the payers, and the intermediary, another piece of that is understanding that there are many ways in which the project can be successful. You could have no NICU utilization, but not an increase in breastfeeding, which in this case, if we solve WIC and maybe we say, okay, that is success. Or you could have the students all come and be ready for kindergarten, but the quality counts didn't really expand on their talent pipeline as much. Or we could have a decrease in maltreatment, but not as many moms in the community doulas. So there's a lot of ways in which it would still really be successful. And so what's also important when figuring out the pay rate here is how to balance all of that and say, what are the different iterations of what success looks like? We can't begin to sort of predict or dictate how many units of outcome we want to have for the community. We want to say that we're going to meet families where they're at because we don't know the level of each intervention that will be needed, because we can't really say if the families are going to want doulas or home visitors or focusing on going to the parenting classes. And so what's been innovative and resilient, and I think also scalable, and in a lot of ways sort of simplifying about all of this, is saying there are lots of different ways to get to success. And you have to build that in at the time when you're setting your pay rate.
Yeah, and when Janice was talking about that starting point, one of the real benefits of this project is if we just plugged in for the pay rate our best estimate of the value, we would have had payments that would equal about 3 times the costs. And that gave us a lot of room to build out that resilience to provide a reasonable return to the investor without having to worry about things like perverse incentives. So for instance, there is absolutely no pressure on metrics like substantiated cases of abuse and neglect to not substantiate actual cases of abuse and neglect. It was really important to the community that if in fact, what if in the community they discovered that there's a community where reports don't go forward because of pick your reason. We don't want to let that stay. We want to be able to say, oh, well, we had more substantiated cases of abuse and neglect because we were catching them and getting supports to the families that needed them, and not have to be like, oh, but that's going to hurt our evaluation. So that was part of the balancing as we were looking at these 12 metrics. How do we make sure that we're not beholden to a particular metric, that we're looking at a holistic picture of success?
Yeah, thanks, Brian. I think that was also a principle that we all held really at the center of building this, is that we didn't want any perverse incentives to cause us to cream and look for sort of the easy folks to serve. We actually wanted to build this in a way where we wanted to reach the hard to reach. So I think that that's also happened somewhat in, Birth Matters and the community doulas. Some of the moms have turned out to be younger than we all expected. And that's harder to serve. But even though their roles are full, we're not saying, it actually serve the age range we had all talked about. We're saying meet the families where they need to be and serve the moms who need this most. And that wouldn't work without the pressure valves, so that no one metric sort of had oversized importance.
Yeah, exactly.
I have a question here. How do you evaluate projects? What are their criteria for PFS?
Can I? All right. So we have two forms of evaluation, and we have two different. We have a validator and an evaluator who are providing that independent lens for it. So on some of these metrics, there are things that you can directly watch in real time. Things like providing services for the full 5 months after the birth for the community doula and things like that. We have a programmatic validator who looks at them directly. But then, for the evaluation geeks on the call, we have a synthetic control methodology that has created a fictitious Spartanburg, based on historical data and looking at matching this synthetic Spartanburg's trend lines on each of these metrics, to real Spartanburg's trend lines. And then from that point forward, that control, it's sort of like an RCT, but you don't have to exclude people. So that control group persists going forward. And then we get to see the improved outcomes over time versus that control group. And so that's if anybody wants to, feel free to email anytime. We can talk about synthetic control methodologies for as long as you like, because they're really fun. But that's the quasi-experimental component of the evaluation.
And it was critical because we had a population-based project.
Yes.
So, having an RCT with a control group was not possible. But how then do you determine causality and impact? And so this was a methodology that is a new methodology, actually, in evaluation sciences, I believe, that was used in order to be able to say, okay, on a community level for these metrics, what's the impact? And so, yeah, that was very exciting for those of us who are geeks. That was very exciting piece of the project.
Okay. I think we have one more question. Okay. Could you please tell us more about the role of the outcome payers? What is their role in project development and governance? How often do you report to them? Do they approve the refinements to program delivery, or are they kept at arm's length? Were you able to get all of that?
I'm just looking to see who wants to start.
Who wants to take it?
Brian, I think you should sort of start because in a lot of ways you sort of represented their interests in our working calls, right? I think
That's
we can
right.
touch on that.
So one thing that in order to discuss this, we really have to credit the community of Spartanburg. They had spent probably a decade of really intentional work prior to this project on the relationships and the social capital amongst the service provider community and the philanthropic community and the governmental entities. And so there was first off, there was a significant amount of trust that existed among those partners. And so it was relatively easy to negotiate because they were able to say, you know what, we trust Molly at the Mary Black Foundation, we trust Chris at the City of Spartanburg. We'll let them do the first take on these negotiations, and then we'll look at what they provide. And part of that was because Chris and Molly also really knew those partners and were able to flag things like, hey, this is going to be an issue. So they were with us throughout the development project of this. For the most part, there were a few outcomes payers who came in the last 6 months or so, or the last 2 months, right at the end of the project. But by and large, the outcomes payers were along with us for the whole project development. We report formally, we report to them quarterly. We have a 6-month report that we send out that's written, and then an annual. But we also, as part of that relationship development, many of them communicate weekly or monthly just through other collaborative projects that they're working on. But for those who don't automatically have that kind of outreach, we have purposeful quarterly check-ins with them. What did I miss?
Anyone want to add to that? Okay.
Sorry, I would just add that they've continued to be great partners, and there's been a lot of problem solving. It wasn't just us as the investor that got to say, yes, let's lean into the WIC learning, or let's do the formula bank, or let's reassign some budget line to sort of developing a network amongst the interventions and the providers. That was a really nice sort of unexpected outcome, all the team building that Caitlin's been doing. So we've been very blessed and very lucky to have such engaged stakeholders, because once you get past the launch, since we've all done all this work about aligning everyone's incentives, we don't sort of sit across from each other at a table. We all sit together, and we try to build together as partners. And Brian taught me early on, the project moves at the speed of trust, and that has been true. But actually now we've all been together for so long that it's a very fast speed. Now we can just move in shorthand, and we wouldn't be able to without all that trust. And that's across all the different stakeholders.
Mhm.
Great. Well, thank you. And thank you all for joining us. I want to give a special thank you to each of our panelists. The video from this webinar and other assets will be shared via email and social media. We hope you will all join us for future Ascent series convenings from the Sorenson Impact Institute. Thank you again.